What is CLABSI rate? The infection control department informs you that your ICU has a higher than acceptable rate of central line associated bloodstream infections. How are you going to manage? How are you going to investigate and manage the situation? So what's the CLABSI rate? Central line associated bloodstream infection per 1000 central line days. So infection divided by central line days times 1000. How do we investigate this? So firstly, you need to involve the relevant stakeholders, including nurses, infection control, ICU medical staff, and then form a working party. First, we need to make sure that the data is correct. So review the data of the audit to ensure that the counts are correct, and then the data quality and that the data quality issues are not responsible for false estimation. And then you need to review the cases of confirmed bloodstream infection and ensure no false positive or negative infections are there. Also, we need to review the counting of line days, as missed days will result in artificially high rate. Then you need to benchmark this rate against published targets or benchmark against peer hospitals. Then we need to explore existing CLABSI control measures, and we need to find out what are the barriers to their implementation. Explore the evidence for CLABSI control measures. So what is the current evidence? And then combine the best evidence into an updated policy. So the next question is that how do you manage the CLABSI risk? So if increased risks are confirmed, and if increased rates are confirmed, then investigate potential causes of the high rate. Why is it occurring? Implementation of specific strategies based on best available evidence. So specifically what you're going to do, you're going to start training of your staff, and in terms of use of correct aseptic techniques, in terms of insertion site selection, in terms of use of insertion bundle or checklist. Also, we need to consider limitation of line insertion to an accredited group of experienced operators. Then we need to document the daily review of the line, removal of all the lines at the earliest possible time, use of antimicrobial impregnated lines, chlorhexidine plus alcohol as antiseptic. Consider alternatives to conventional CBC, example a PICC line. How do we do ongoing monitoring? So we need to do audit of the process, such as observation of aseptic technique, ongoing, and then we need to continue to monitor the rates of CBC infection over time. So now that we have made these changes, we need to just monitor the rates, and then submission of data to NZIC's core CLABSI registry, and then regular reporting back to staff in the hospital infection control committee.